My name is Aaron Kuo, and today I'll be talking about herpes. Currently, herpes exists all throughout society, as more than 1 out of every 6 people ages 14 through 49 have genital herpes. There are currently 3.7 billion people under the age of 50 who have herpes simplex virus 1, which accounts for 67% of that population bracket. Another 417 million people have HSV2, which goes to show how common the herpes virus is. It is important to distinguish early on that there are two main kinds of herpesviruses, which are HSV1 and HSV2. It stands for herpes simplex virus 1 and virus 2. Most individuals infected with HSV are asymptomatic, or have very mild symptoms that go unnoticed or mistaken for another skin condition. Herpes can occur when individuals have vaginal, anal, or oral sex with someone who has the disease. Another method is coming in close contact with the herpes virus by means of a herpes sore, saliva, genital secretion, or skin in the oral area of an infected individual. Currently, herpes is present worldwide, with sub-Saharan Africa being the most infected, with 134.9 million people, as you can see on the diagram in the lower right. So, future risks in the community. Future risks in the community include lack of education and proper knowledge. Cases of herpes are more likely to occur when people are unaware of the situation, therefore giving individuals the proper resources and up-to-date information is essential. Not to mention, behaviors like unprotected sex and having numerous sex partners can drastically increase the risk of individuals getting herpes. The risk is particularly high among teens and young adults who are more likely to take risks with sex. In terms of etiological factors, as mentioned earlier, young adults and teens who have sex at an early age are more susceptible to the virus, especially if safety precautions like condoms are used incorrectly. Many studies have found that genital herpes is more common in women than in men, but the infection spread from men to women more easily. Those with prior STIs or HIV infections will have more trouble fighting the disease. The risk all depends on an individual's exposure to the infection through sexual activity, since anyone can be infected with HSV. So how do we solve the problem? Since there are no known cures to herpes currently, the first strategy would be knowing those who are infected and their symptoms. Therefore, they can be treated and given medication which can help relieve symptoms and make it less likely to spread herpes to a sex partner. Education is the main strategy, since many people have herpes, don't know they have herpes, since the symptoms are asymptomatic. Next, strategy 2 would be to practice safe sex by utilizing a latex condom. Not to mention, being in a long-term, mutually monogamous relationship with a non-infected partner can be extremely helpful as well. Next, I'll be talking about two historic examples. One comes from 2014, one comes from 2018. In 2014, HSV 529 was a herpes vaccine trial which contained a strand of HSV in which two important viral proteins had been deleted. Therefore, HSV 529 can infect cells but cannot replicate to make more copies. As a result, the vaccine elicited neutralizing antibody and modest T-cell responses in HSV seronegative vaccinees. The second is a new class of drugs found by the University of Illinois at Chicago in 2018. These drugs can be used to treat herpes, and currently there are just a handful of drugs available on the market to treat the painful conditions of herpes. And if patients develop resistance, there's not many other choices. So therefore, researchers have now identified a small drug molecule that can clear the HSV infection in the cells of the cornea, which is the clear outer layer of the eyeball. And it works completely different from currently available drugs, which makes it a promising potential option for patients who have developed resistance. So public health in the future. What does literature say? In terms of the future, literature says that the first best option would be to abstain from sexual activity. If that's not an option, then the next best would be to practice safe sex. Not to mention, do not have sex during a herpes outbreak, and to make sure to always tell your sexual partners if you have herpes. Currently, a barrier to effective implementation of educational intervention is the low level of accurate knowledge among the public about genital herpes, asymptomatic shedding, transmission, and much more. Therefore, mass educational efforts can be helpful in reducing the number of cases of herpes, and this can be done through creating educational campaigns about genital herpes and government-implemented educational programs among the youth. There is a higher chance that individuals partake in safe behaviors with more knowledge and information. The increased awareness, along with sex education, can make people more aware not to spread the disease through sex. Lastly, I'd like to wrap up the presentation by talking about my personal opinion. My personal opinion is that since currently there is no known cure for herpes, the best way to prevent herpes is to stay educated. Currently, there is still a lack of information needed to create a vaccine, so individuals can only rely on education to stay safe. Practice abstinence if possible, but if that's not a choice, then definitely engage in safe sex practices like using a latex condom. Furthermore, it is important to stay informed about all information, whether it be your partner's sexual history, knowing the number of sexual partners, or even asking your partner to be tested. The more information individuals have access to, the more knowledgeable they are about herpes, which can help reduce the number of individuals infected in the future. Even if individuals are infected, the increased awareness on the virus can help them get the necessary help they need, specifically in terms of medication. These are my references. Thank you for listening.